The impact of illiteracy on motivation and compliance. Objectives: define illiteracy, functional illiteracy, low literacy, and health literacy. Identify your responsibility in communicating with a patient. Discuss communication skills that are needed when working with the illiterate patient, and walk away with ideas and tools for communicating with our patients. Upon completion, the learner will be able to define forms of illiteracy, identify their role as a healthcare provider, gain skills to improve communication, and obtain tools for using in the clinic. There are 3 types of illiteracy. There's health illiteracy, functional illiteracy, and low literacy, and these are the ones we're going to be focusing on today. Illiteracy in general is defined as someone who is unable to read or write at all, or whose reading and writing skills are at the 4th grade level or below. Functional illiteracy are adults that lack the fundamental reading, writing, and comprehension skills that are needed to operate effectively in today's society. These people may be able to read words, but they can't necessarily follow the directions in step-by-step form. Low literacy is the ability of adults to read, write, and comprehend information between the 5th and 8th grade levels. They cannot read schedules, or they have difficulty filling out general forms. Health literacy is the ability of a patient to understand their health information so that they can maintain a level of wellness that is optimal. Knowing your patient's health literacy will improve communication so that your patient will be motivated to maintain their own health. What else does illiteracy affect? It affects the comprehension of the patient. If they're not able to understand the process for imaging, if they can't read it and know what the process is. Problem skills. Sometimes they run out of medications, or if an equipment malfunctions, they don't have the problem-solving skills in order to work through the problem and know what to do next. Their thought organization, timing of the medications. If they have to be NPO for testing, they're not able to think through the organization of how to stay NPO 4 to 6 hours beforehand. They may not know what to ask, and if they can't understand the procedure, then they don't know what to ask in order to be ready for the procedure, and then just their perception of the process in general. As healthcare workers, it's important to make sure that your patient feels comfortable asking questions. Almost half of adults are functionally illiterate, and this is a major factor in non-compliance. If they don't feel comfortable asking the questions, then they're not going to comprehend the instructions. So it's important to also make sure that they can comprehend the instructions that you're giving them. And then we need to motivate them to follow through with the instructions that we have given them. So how do you motivate somebody? Well, if they know the why, then they're more inclined to do. They need to know why because it's for their overall health and safety. They need to know that in order to maintain their health, they have to know why they're doing it. Some tools that they can obtain in order to complete the task required, maybe scheduling their appointments for them, or get them in some hands-on classes, give them some take-home calendars so that they have something in hand when they leave that will help them to be motivated and stay motivated to do what they need to do. So learning your patient's communication level. Assessing the patient's prior healthcare experience. If you know that they've had a bad experience in the past, knowing how it made them feel will help you gain their trust. And if they have their trust, then they're going to be more motivated to listen to you and what you need them to do. Finding out how they learn best. Hands-on is going to be huge for the illiterate patient. If they feel confident with their new information, then they'll be more motivated to comply. And again, giving them those tools to perform their tasks easily is going to help keep them motivated. If your patient needs to read out loud, a lot of times that helps them comprehend the information better. So you want to make sure that they have a private room so you can avoid embarrassment or decrease their distractions. If they are able to focus on what they're reading, they're going to be able to comprehend it a little bit better. And then provide pictures for identification of topics. If they have a picture in front of them, then they're going to be able to understand what you're talking about instead of trying to figure it out in their head. Tools of the trade. Provide medication calendars for the patients to take home, written instructions. If you have to have the written instructions, make sure that there's a picture next to the instructions for exam prep. If you need them to be NPO 4 to 6 hours, put the time down and then put a picture with no food on it. We're going to get to that here in just a minute, but you'll see if they have the picture with no food, then they'll know not to eat after this certain time. Keep the instructions simple. You want to give encouragement and praise for tasks performed correctly. So if they're learning how to plug in the tubing for the oxygen tank, you show them how to do it. You're plugging it in correctly, putting it on their nose correctly, then give them praise for that. Follow up, follow up, follow up. You got to make sure that the patients are followed up with, because if they so easily fall through the cracks if you don't. That means maybe entering dates in their phone with reminders for appointments. A couple of days beforehand, you might want to put the note that pops up and says, hey, schedule a ride for 2 days. Give them the time that they need to, and even the phone number for the ride that they might have to organize, so that it makes it simple for them, as well as giving them the information that they need to give to the driver. On the day of the appointment, put another reminder in so that the patient knows, oh, hey, I've got the appointment today. Here's the time. Your driver's going to be here. You've already set it up. Or contact a family member that will help them remember. If the family member can call them a couple days before and say, hey, I'm going to pick you up. Make sure that you're ready. The morning of the test, I'm going to pick you up at this time. Make sure you're ready. Here's pictures of some color-coded calendars. These work great. The patient, you can know that, hey, this is the month of January. Put pictures of their pills. If you need a medication calendar, put the picture of the pill and the time that they need to take it every day. Or if they need to take it with food, maybe put a picture of food next to the pill. And then, the patient knows that at this particular time, I have to eat and I have to take this pill. If you don't want to necessarily use a picture of a pill, because some of them can look similar, put the exact same wording that's on the pill bottle that's on the calendar, so that they can match the words up, the letters up, and know that this is what I have to take at this certain time. And these are the pictures I was talking about. If we have pictures of physicians or pills, an x-ray, here's the no food sign, this can help the patient know what instructions are given. Or also the patient can point to something and, hey, I don't quite understand what you were talking about with the x-ray picture or with the food picture. Why can't I eat? If you can explain to the patient why they're not supposed to eat before an exam, you're going to have a lot more success. In conclusion, caregivers often overestimate an individual's ability to understand instructions and are quick to label someone as uncooperative. In reality, the underlying problem may be limited cognitive processing that impedes comprehending and following written and oral communication. It's so important not to jump to the conclusion that the patient is not compliant. Take the time to listen to what the patient is saying and read their body language and give them time to speak. No matter their level of health literacy, if they feel comfortable and trust, the experience will be much more successful, not only for the patient, but for the healthcare provider as well. Quiz time. Here are the quiz questions. Answer these questions and turn them in. At the end here, we have a little essay question. Basically, just write out a creative way that you have used in the past to communicate with your patient and how it was successful. Whether you use calendars or pictures, demonstrating the equipment, that kind of thing. Just kind of write out what you've used in the past and what you've had that's been successful. And if you used it and it wasn't successful, that's fine as well, and what you learned from that. Thank you and have a good day.